So do you remember your childhood dream? What did you want to be when you grew up? I wanted to be a doctor, and I wanted to practice in an underserved community. So I found myself in Appalachia fulfilling that dream. And women's health became an area of major concern for me. Women were coming into the office. They had undiagnosed hypertension, they had end-stage breast cancer, and they weren't even aware that they had these serious diseases. And that really troubled me. And as people came in from the mountains to see me, or I went to their homes, I began to realize that health was much more than just an individual problem. It was a community problem. And it was that light bulb moment that set me on my career path where I wanted to help as many people as possible achieve good health. Well, I found myself on a career path that took me many different places. I found myself going down, I practiced medicine, and then I found myself teaching, being a hospital administrator, a state health officer, and then doing important work at CDC, leading efforts there. But now, as the CEO of the CDC Foundation, it's really exciting to help advance the work of the agency. Now, how many of you, let me see a show of hands, how many of you even know that there's a CDC Foundation? So I see that a lot. A few hands went up. Most people know about the agency. You've heard of CDC, and CDC safeguards our health and protects all of us. But many people have no idea that there's another way to work with CDC. So the CDC Foundation, what we do is we unleash the power of collaboration between CDC and others to be able to advance this life-saving work. So as an example, at any given time, the CDC Foundation is actually managing over 300 programs that are CDC-led here in the United States and in 100 countries. So as an example, this is Jerissa Bessman that you see in the photo here. She was hired by the CDC Foundation during the Ebola crisis in Liberia, and she tracked people with the symptoms of Ebola. And her work was paid for by one of the founders of Microsoft, and that was Paul Allen through his foundation. So let me dig into a little bit more of the global work that the CDC Foundation does. And so I've got a quiz for you. So here's question 1. Can you name for me a country where maternal mortality is increasing, and 700 women die every year, and 50,000 have very serious pregnancy complications? Wow, you guys are good. America. So what's happening in one of the wealthiest countries in the world, right? So the CDC Foundation has a program now where we're trying to improve these outcomes, and it's thanks to Merck for Mothers for sponsoring that. Okay, well, let's see how good you are. Here's your next quiz. Can you name for me a country where every hour a woman is dying from pregnancy and childbirth? That one's Tanzania. So can you imagine protecting mothers and babies from deadly health threats? Thanks to support from Bloomberg Philanthropies, we have a program at the CDC Foundation that, as we speak today, is working to offer emergency care to women in the western part of Tanzania where they have the highest mortality. So what if we all come together and work to help improve health? Thanks to our donors, we've been able to do this in a number of ways, but it really takes all of us. And you know, government can do a lot, but government cannot do everything. So it really takes all of us to make a difference. And that's what the CDC Foundation does. The stories I've told, we bridge people and ideas to try to improve health for many, many people. So in fact, the CDC Foundation has launched nearly 1,000 programs in the last 22 years. We have provided more than $700 million to support CDC's work, thanks to our donors, and we've saved and improved millions of lives. All of us have the power to dream big and to really create change, no matter what our talents or our passions might be. So these examples, as well as my own life story, are examples of that. Together, our impact is greater. Thank you.